So we are just a few minutes finishing up this hair transplant. We took hair from the back and placed it into the sideburns and lower temporal hair to cover up previous scars from a facelift that was performed locally here in Dallas that led to some hair loss. There was actually a U-shaped scar going across here. That U-shaped scar caused some hair loss in between the two areas. The sideburn was missing from having that removed. And so what I did here was I created recipient sites on this side that angled across this way and then down this way. So I followed all what I call the ghost hairs, which are the hairs that are there, so that her natural hair would blend with what I've been transplanted. That way she can wear her hair up. The left side is not as bad as the right side, so I'll show you the other side here as well. We'll look over here. So this side is actually much more extensive. I would say about 2/3, 3/4 of the grafting was done over here. And the same thing on this side. You can see that the sites were made, it's probably hard to see directly, but they come down this way and these sweep backwards. It's very important when you design these sites that you have a few principles. Number one is that they have to be very flat, otherwise they look weird and they're very hard to lay down or lie down. And so mine are done with what they're called coronal sites, or actually lateral slit as semantically pure, which means that the sites are made this way so that the hairs don't go out too far. Technically, it's very difficult to do because you need to make those sites around 10 degrees or lower. If you make the sagittal sites, which go in this direction, there's a tendency for them to roll upward. So that's what I've done here. And also, it's very important that you match the hair angles the way that they go out. So they go this way, down this way, and down. Actually, the other side, they go farther down. So I matched the other side slightly differently. On this side, they go farther back before they trail downwards. So that's one very, very important thing, is that they have to be flat. And the second thing is that the angle changes. You have to match the current angle changes. How was your experience?
Today it was awesome. It was great.
Not too
Everything
bad.
was pleasant. It was not painful.
Good.
I feel good right now. It's 1 o'clock and I'm ready to go home.
Good. And so this was mainly due from a previous lifting procedure you had done elsewhere.
Yes.
And what bothered you about this?
It was the scars I could not pull my hair back because these were very, especially on this side, it was a very obvious scar. It was a white, very obvious scar that couldn't be covered up.
And also, I assume that some of the loss of hair bothered
you.
Because you
yes.
mentioned you couldn't wear your hair up.
Could not wear my hair up.
Good.
So I guess by saying the scar, I meant the scar because all the hair loss that was associated with it. Exactly.
Okay,
exactly.
wonderful. So thank you for letting me film this.
Okay, thank you for doing it. I appreciate it.
We appreciate you.